I hope I understand that all of you must be aware of what day today is. Today, the 1st of December, World AIDS Day, which, what does it show? It is actually an internationally recognized day that aims to raise awareness about HIV and AIDS and stigma and prejudice, to end the stigma and prejudice against HIV and AIDS through education and advocacy. It also reminds us about how the HIV and AIDS are still not gone away from the society. It is still there, present in millions of people around us. Now, is HIV and AIDS the same thing? You should all know that everyone must be having a misconception saying that HIV and AIDS are similar. But no, HIV is human immunodeficiency virus. It is a type of virus which is known as a retrovirus. Why it is known as a retrovirus is because it is basically an RNA virus, and when it goes into the human body, it gets converted into a DNA strand. Now, this actually invades the helper T cells and it replicates inside these cells, and it becomes too much inside the cells, and the cells are destroyed. And once the helper cells are basically the immune system or in the body of human beings, gets destroyed. And once it gets destroyed, it becomes less and less in the human body. And because of that, that is why the terminology immunodeficiency, that is why it is termed as human immunodeficiency virus. It does not have any cure. What is AIDS? AIDS is acquired immunodeficiency syndrome. This is an infection or the disease which is caused by the HIV virus. It destroys the immune system of the patient's cell, the patient's human beings, and the ability for the human being to fight against other infections. So that is why, again, the disease is also termed as immunodeficiency, acquired immunodeficiency syndrome. This also does not have any cure. It only has some treatment, but no cure. Now, you can see that globally or worldwide, there are about 38 million people who are living with this virus. In India, the statistics of 2019 shows that there are around 3.4 million people living with the HIV virus. Now, in 2004, there was a lot of mortality due to this disease. But of late, it is reduced to around 61%. Now, in 2020, the year 2020, around 690,000 people died from AIDS-related illness worldwide, which is much less compared to the 1.2 million in 2010. Now, coming to the first things, when the AIDS or the acquired immunodeficiency syndrome was reported, it was first reported and identified by the CDC, that is the Center for Disease Control and Prevention in the US, in the year 1981. And in 1984, the immunodeficiency virus was identified as a causative agent of this particular syndrome. Now, here you can see the pictures of the two people, that is Barr and Sinuse and Montagnier, who were the two people, scientists, who were responsible for identifying the virus, and they got the Nobel Prize for the same. Now, in India, when we come to the syndrome in India, we found that in 1986, that is the place where it was identified from a commercial sex worker in Chennai at the Institute of Microbiology, Madras Medical College, from where I hail. I have retired from there, and I was there at that time when I were able to identify the case. Now, this was the first case which was identified in India from the sex worker. Now, it is normally seen that you find these infections mainly in the heterosexual group of people. That is, when one man goes with many women or one woman goes with many men. That is basically prostitution. And of course, drug users. But the main way of transmission is through sex. Now, what do you mean by the stigma? That is what we were telling, the awareness to end the stigma. Now, what is stigma? When the people living with HIV are judged and treated badly because of the prejudice and assumption about HIV. They are actually treated very badly. They are treated as untouchables. They don't come near them. They are thrown away from society, etc. Now, this is all because you are not aware of the disease or of the way it is transmitted or how it is going to come to you. So that is why it is normally you're having this stigma. Now, what do you say? Basically, why is the stigma is that it is due to sex. That is where it is getting transmitted. And sex or prostitution is against, or it is prejudiced against the society. So society actually shuns the prostitute people. So that is one thing. Then the drug users also, they are not accepted in society. So now this is the reason why we have the stigma against AIDS or HIV. Now, people who are living with HIV, what happens to them? They lose their income because they are thrown out of their place of work. So livelihood is affected. Then they are not able to get married. And because they are not getting married, they are going to have no children, no childbirth. Then they are taken very poor care of from the healthcare workers because they are again feeling bad because they are like untouchable people. Then they are even inside their own homes. What happens is that they get shunned away. They are kept in one room, or they are pushed off, and they said, you don't eat with me, you don't come near me. So that is what happens even in their own houses. Then they lose their they think that they are worthless to society and their reputation is gone. So these are the things which happens to the people who are living along with AIDS. So now coming to how the actual disease or the HIV virus is transmitted through society. Now, first you have it through, basically it's a disease where it is seen the HIV is in the blood. So it is transmitted through blood and blood products. Then it is also transmitted through other body fluids like semen, vaginal fluids, and breast milk. Now, it can also come through, it is definitely coming through sex. That is one of the main type of infection, how it is transmitted. That is through intercourse or oral or anal. Then through IV drug users. Now, these IV drug users normally use the same needle to inject themselves and then pass it on to the next person. When the injection goes from one person to another, what happens is the little bit of the blood will be connected, or it will be attached or sticking to the needles. So the same needle goes to the other person, that blood gets injected into the other person. So if the person is infected, then you're passing on the infection to other people. So always try to use sterile needles, even when all of you go for any blood test or any other lab tests which you go, you see that they are using sterile needles for injections or for collecting of the blood. Then from mother to baby. Now, when it comes from mother to baby, it is either before birth or during birth, when the baby comes out through the vagina, the vaginal fluids are there, which may contaminate, which may infect the baby, or it is after the birth, because the baby may be having breast milk and etc. from the infected person. If we do not know if the mother is infected, then it can also pass through like this. Now, what are the misconceptions that HIV will not be passed through? So that is one major thing which all of you should understand. This is where the stigma comes. This is where you say that, no, I cannot touch you, I cannot hug you, I cannot kiss you. So by all these means, it does not spread. The HIV does not spread like this. It does not spread while hugging, by kissing, while coughing, while shaking hands, or by mosquito bites, like many of the other virus infections like malaria and dengue, etc. It doesn't come by mosquitoes. It does not come by using the same toilet. It does not by using the same telephone receiver or the same cutlery, by sipping from the cups where a person who's infected is used. So you never shun the person. You take them and treat them like an individual and like your own sister or brother, and help them out to fight the disease. So that is why this is a awareness to bring to all of you, that it will not be, HIV does not spread by this means. Now, basically, the HIV virus, I'll just give you 2 lines, about a few seconds about the HIV virus. It is just like any other virus. It has got a shell, and it has got all the spikes around it. Now, as you must have already, all of you must be aware of all the pictures you see in the paper about the pandemic COVID-19 or the SARS-2 virus, caused by the SARS-2 virus. It's a similar type of virus, except that it is also an RNA virus, but basically it is a retrovirus. Now, because it has a reverse transcriptase in the an enzyme which is present inside the cell, which when it enters the T helper cells in the blood, it will get converted. The RNA genome gets converted to a DNA genome. Now, what happens in the life cycle of this? Now, all of you must have learned about the WBCs, or the white blood corpuscles. Now, these white blood corpuscles, or the white cells which are present in the blood, is supposed to be the immune system, make up the immune system with all the different types of other cells in the immune system. Now, in that, you have what is known as the T cells. Now, the T cells and the CD4 cells. Now, the CD4 is the receptor sites on the T cells, on the T cells, which will help the virus to attach itself onto these T cells. And once it gets attached, it pushes its genome inside, and the genome goes in, gets converted into the DNA virus genome, and then it starts multiplying inside the T cells. Now, once it multiplies inside the T cells, large number of genomes are formed. Now, each genome will be again converted to the RNA, and it will be covered by the capsid and the spikes, etc., just like the outside virus. And then you have a T cell, that is your immune system cell, a T cell in the blood, which is completely filled with viruses. Now, once it's filled with viruses, what will happen? It does not have any space to move inside. It will burst the cell, and it will come out, therefore destroying the T cell. And thus, this T cell or the CD4 levels will start coming down in the bloodstream in the human being. Once it starts coming down, that shows the immune system is deteriorating, and therefore you will start getting infection, more of the infection, and as well as other opportunistic infections. So this is basically the lifestyle. Now, when the virus is present free in the blood, it is known as the free virus. When it is present inside the cell, it is known as the provirus. pro-virus, which is the DNA part of it. Now, what is the infection? Now, the infection goes, or the disease goes, in 4 stages of this HIV virus. It goes in 4 stages. First, the primary stage. Primary stage is a very short stage where it starts with flu-like symptoms. Just like flu-like symptoms, it may go for about 2 weeks, 6 weeks, etc. So here you do not have a time limit. It can go up to 6 weeks, and it will be totally symptomless after that. And then it is at this stage where the infected person starts infecting other people. Now, then you have the stage number 2. Now, in this stage, they become asymptomatic. Asymptomatic meaning you do not have any symptoms. Now, this will go on for a large number of years, around maybe 10 years, an average of about 10 years. Now, here what happens is the virus goes, this is the free virus will not be there much in the bloodstream, but you will find that all will be present as a pro-virus dormant inside the T cells. Now, it will, because it is dormant for a long time, therefore, this stage can go from 1 year to 2 years to 10 years. It can be like that. So once it starts multiplying inside the cells, what happens is that they start deteriorating your immune system, and the disease becomes more and more. Stage, you will be able to identify the antibodies to the infection from the person. Then you come to the stage number 3, where it becomes symptomatic. That is, you will have mild symptoms. You will have slowly the immune system deteriorates. You start getting opportunistic infections. Now, what do you mean by opportunistic infections? Opportunistic infection is nothing but, for an example, suppose you have high fever. It may be a viral fever. And then because of the high fever, what happens? Your immune system is lowered. Now, once the immune system lowers, in your mouth, you normally have what is termed as this a particular fungi, which is the candida, which is present in your mouth, and normally it doesn't do anything to the body. But when the immune system goes down, like when you have high fever for a long time, what happens? Your immune system goes down. Then you start getting ulcers in your mouth. Now, this is when the opportunistic infection, when the immune system goes down, they opportunistically, they come and they start causing infections. Viral infections are caused, then you get from outside, you get the bacterial infection, you get the parasitic infection, you get every other infection from outside. So this is the stage, 3rd stage, when you start getting other infections. And your CD4 levels become very low. Then you go to the stage 4, where a full-blown AIDS is seen. That is when your immune system is totally weakened, and you're fully infected, and you're fully down and very bad, very sickly stage at this stage. Now, what are the different type of opportunistic infections which are normally seen with AIDS? You have what is known as the bacterial infections. Now, the bacterial infections, all of you must have heard about TB or tuberculosis. So this is one of the major infections which are seen in AIDS patients. That is, fully blown AIDS patients normally suffer from tuberculosis. Then you can also have pneumonia. That is streptococcal pneumonia, which is also seen. Then you have viruses. Viruses, you have the different types of cancers. That is, one is known as a Kaposi cancer, sarcoma. Then you have the herpes simplex virus, which causes skin infections. And then you have the influenza virus, which causes the respiratory type of infections. So this is all when the immunity goes down from outside, you tend to get these type of infections. Then you have what is known as the parasitic infections. That is the pneumocystis carinii. This also causes respiratory type of infection. And then the fungal infections, as I've already told you, one is candida, which gives you mouth ulcers as well as vaginal ulcers. And then you have another fungus, which is known as the cryptococcus, which gives you meningitis. So these are most of the common immunocompromised people, that is with people with AIDS, common infections which they acquired from the outside, that is the opportunistic infections. Now, what are the testing modes? You have got the infection, how do we test it? Or do you think you are getting the infection, how do we test it? Now, you have what is termed as the integrated counseling and testing centers all around the place. That is all in all government hospitals. You have them present where you do pre-testing counseling, one-to-one only, and it is always confidential. And then you have the post testing counseling also, which is again highly confidential. Here you can make yourself anonymous. You need not give your name at all. You can just go in anywhere, any of you, anyone can go into these centers and just say that I want to be tested. So once you say that you want to be tested, you go, they take you to a separate room, they keep you separately, they talk to you about the pre-testing, which I'll tell you what they speak to you about, and then they take the test, take the blood to do the testing. And similarly, and they give the results also to the recipient only. They will not give it to any relatives. They will not give it to any friends. They will not give it to anyone. So it is highly confidential. And only thing is, it is reported to the CDCs and also to the corporation and the state government, etc., just to have the statistical statistics for the government. So the results are again issued only confidentially. What are the different blood tests which you normally do? Now this you may not know, you may know some of them, some of the names you might know. So the one is ELISA, or the enzyme-linked immunosorbent assay. All this is done in the blood. All is done in the blood because it is the blood where the virus is present. Then you have the radio immunoprecipitation test, or the indirect fluorescent antibody testing. Then you have the polymerase chain reaction. This, it may be familiar to you right now because we always say about the RT-PCR of the COVID-19 SARS-2 testing. So now the PCR is nothing but polymerase chain reaction, which is also done for the HIV, which has been which they have been doing for a long time. And then you have the confirmatory test, which is the Western blot test. Now, what about the counseling? I told you there is normally a counseling. You walk into a place and you say that I want to be tested. You have what is termed as a pre-counseling, your one-to-one counseling. It is normally done. Now, first they will tell you about how the infection is transmitted. They will explain to you how it is transmitted. They will explain to you how to prevent infections and to prevent the HIV virus from getting into you. Then all the risk factors which come along with the infection. Then you have the confidentiality with whatever you can tell us how we have got infected. You can tell the individual, that is your counselor, how you have got infected. They take you into confidence, and they will not part this information to anyone at all. So this is totally confidential. And the reports also will be given confidentially only to the recipient and not to anyone else. And here also, when the results are being given, if it is negative, fine. They will give you the results, but they will also give you a little bit of counseling by saying what the results are and how we are supposed to prevent yourself totally from not getting infected, even if you happen to go to any of these cases or any of the ways of transmission, how not to get yourself infected. Then also you have to keep yourself tested subsequently when you have to get tested, etc. If you have been exposed, then you are negative now. You have to be tested after some time. They will inform this to you, as well as give you promote how to use safe behavior, and then they will release the results. Now, suppose the person is positive or the result is positive, then they may say that you may have to do a confirmatory test. So we may do another test to confirm your results, and then you may have to go for the treatment. Now, the treatment, you have to adhere to the treatment to see that you are properly taking the treatment so that it helps you to live a comfortable life. Now, why counseling is required is that you have to take the counseling so that it helps you to improve your quality of life and to improve your healthy lifestyle and basically the quality of life. Now, what is the treatment part of the HIV or the AIDS syndrome? Now, here I told you there is no cure. Right in the beginning, I have told you there is no cure at all. There is only one type of treatment, that is the antiretroviral treatment. Now, this antiretroviral drugs which are present, it helps in treating the patient, but not curing the patient. Now, basically, when these drugs are given, they will kill the free virus which is present inside rotating in the blood, and not the pro-virus which is lying dormant inside the T cells. And therefore, when you are therefore the load of the virus which is present in the blood will come down. So when this load comes down, therefore the infection of further T cells or the WBCs or the CD4 cells will not be there. So therefore your immune system will remain good. It will remain good and it will not deteriorate further. And therefore you can lead a comfortable life. Not only lead a comfortable life, you will not be getting opportunistic type of infections. So for this sake, people who are suffering from AIDS should take their treatment, antiretroviral treatment, in a proper way and in a systematic way, and follow the treatment as mentioned by the doctors or the clinicians. So this is one of the major things. Then you have also treatment for the opportunistic infections which the AIDS patients can suffer from. So that will help again to bring down a little bit of the other infections so that you can lead a better, comfortable life. Now, what is the mode of prevention of this disease or the AIDS? It is basically abstentions. That is saying no to everything, absolutely no to everything. And so that you're saying no to heterogeneous sex life, that is one man to many women or one woman to many men should be a no, totally. It should be always one person to one person. So one man to one female to one male. So that is how sex should go on. And even if you have any doubts, then you use protected sex, that is using of condoms, proper good condoms. It should not have holes in the condoms. They should be good quality condoms, and if necessary, use 2 condoms and have proper protected sex. Then use only sterile needles. And even if you are going to use, you're not supposed to be drug users, but if you do use, please don't use same needles from others. Even if you are going for any operation or any laboratory work or anything, you see that they open up new needles, sterile needles, and then use them. Never say no to other needles, ordinary needles. So that is how you prevent yourself, the 4 ways to protect yourself from the infection. Now, coming to this to the end, I've come to the end. That is, to summarize, I'll just tell you something, that HIV and AIDS is not the same thing. HIV is the virus. AIDS is the disease which is caused by the virus. And basically, both of them are because of they produce an immune deficiency in the body, and therefore producing other infections. Now, if a person gets the infection, they should adhere to the treatment levels such that they can lead a normal, good life. Then people should not end the stigma against HIV, because it is not spread by stupid means like hugging or kissing or using the same cutlery and all those things. So that is one thing which you should not do. And then I would finally tell that you can support World AIDS Day by wearing a red ribbon and keeping yourself in such a way informed about the infection of AIDS or HIV and spreading it to your friends and imparting the information to your friends and to the society all around. Thank you very much for the patient hearing.